Hi, it's Jessica DaMassa with WTF Health. Joining me right now, I have Glen Tullman. He is the CEO of Livongo, one of the fastest growing chronic condition management companies in healthcare. Glen, good to see you.
It's great to be here. Always great to talk to you.
Always great to talk to you too. So you guys have had like a massive couple of months kind of leading up to this. You've invented a new category of healthcare, which I need to pick your brain about. So applied health signals. What is this? And why have you invented a whole new category to define this?
So we had to invent a new category because of what we do. So we're creating a new kind of experience for people with chronic conditions. And the challenge was we use a lot of the traditional categories in what we do.
Okay.
So people would say to us, you have these really cool connected devices. Are you a device company? And we'd say, no. And then they'd say, well, you have coaches that are available 24/7. Are you a coaching company? No. What about data science? You have more data scientists than you have software developers, which is not really true, but that's what it seems like. And so he'd say, no, we're not a data science company. And finally, they'd say, well, what about clinical? Are you a diabetes company or a hypertension company or a behavioral health company? No. What we do is we use all of those together. And that's why we needed some new description. So essentially what we're doing is we're taking all this information from those connected devices. We're then using all that data science and clinical knowledge to figure out what it means to interpret that. And then what makes us unique is then we deliver it back to the people with the chronic condition. And last but not least, we iterate just like Google does to say, did it work?
Right.
So what works for you might not work for me on a particular chronic condition. By learning, and we're doing more than a transaction a second, we get better and better results. So just like Amazon knows what book you want to read, we know what'll work, what tools you need to stay healthier.
Okay.
And that's what applied health signals is all about.
Is this something that you see expanding as a category in healthcare? Or are you guys going to have a lock on this for a while?
No, I think there's a lot of people who have pieces of it.
Yeah.
But the big problem with healthcare is today, healthcare is something that's done to us. And we want to be empowered. We book our own travel now. We used to be told we can't do that. And we order cars now. We love being empowered and being consumers.
Right.
And so what we want in healthcare is we want to control what happens to our own bodies. That shouldn't be such a big deal. That's what we're enabling people to do with better information and with using the signals that they come from their own body, the health signals, and feeding them back in ways that they can make it easier to stay healthy.
This is really a paradigm shift, and it's funny. So, I spoke earlier today with Jane Metcalf, who's the founder of Wired, and now she's got that new publication, Neo-Life, right? So we were talking about something similar, and I had said to her, and this kind of just came out, and I'd love to just get your off-the-cuff response to this as well. But it's like we keep talking about health tech, and it's like, have we kind of maybe transcended that, and are we now, instead of health tech, tech health? What does that do? I mean, if we change the vernacular around that.
Well, I always say when people talk to me, particularly here in the Valley, when they say, what about the technology? And I always say, it's not about the technology. You don't say, what technology is in that microphone? You just use it.
Right.
We don't say, what technology is behind Google or even in our phone? What microprocessors are in there? We don't do it. We just use it. Healthcare has to get away from saying health tech or tech health, and they have to say, we're delivering an experience that people like, an experience that makes it easier to be healthy. So again, anytime we can anticipate what you need and deliver you better choices, then we win. Yeah. And that's what we have to do in healthcare.
The closest thing to this applied health signals, other than what you guys are doing, I mean, really, I start to think about it, and I do start to think about those traditional technology companies that have really, this is not their first push into healthcare, but this is the one that seems to be getting the most traction, especially lately. So, Apple, Amazon, Google, all of them are really starting to push, and the stuff that they're pushing in with, Microsoft, they're coming from different corners of the market, right? But it's like they've got that kind of, I don't know, that different look in terms of applying technology to kind of make it seamless and effortless. How do you feel, I guess, about these technology companies coming in? Is this really the silver bullet we've been waiting for? Or do you think that they really need to take a step back for a minute and respect the fact that it's healthcare is a totally different animal than where they have been?
Well, look, way back from the days when Google and Microsoft both tried to enter healthcare unsuccessfully, and they gave people more to do. So I have an Apple Watch right here. And if you ask any cardiologist, they'll say this is a disaster. Because what we've done is we've given people lots of false signals. We've confused people. And today there's this myth of more. The more we give people, the more doctors, the more apps, the more devices, the healthier they're going to be. And the people are saying, like, no mas. You know, they're basically saying, look, I want you to stop making it more confusing, more complex, and more costly. I want you to make it easier.
Right.
So this actually, it goes off. I have another device to charge. Frankly, I love aspects of it, but it added complexity, and it surely added cost.
Right.
And so what we're doing is taking all those signals, making them easier. Again, if you look at IBM Watson, why haven't they been successful? They clearly know how to aggregate data.
Yeah.
They clearly know how to interpret it, but they can't get it back to us to change our lives, to make us healthier. And that's what we're doing. So just like you remember when Apple Music came out, and then all of a sudden all these other people said, we can do what they do, and everybody would say they're trying to be like Apple.
Yeah.
Instead of saying, no, Apple figured out what the experience should feel like. And that's what Livongo does. That's a secret sauce. We've been able to do that.
Now you guys are expanding. I mean, you're famous for diabetes, right? But you're expanding out of that. So where are you headed next? Give us a little bit of a glimpse at the strategy here.
Well, that's actually kind of easy in a way because, so here's what happens. We're in diabetes, and it turns out that 70% of the people with type 2 diabetes also have hypertension. So what we figured out is if we're going to keep you healthy, then we can't just do one silo. We have to take care of your hypertension as well. Turns out that people with type 2 also have weight management issues.
Right.
And last but not least, if you have 2 or more chronic conditions, your likelihood of being depressed or struggling with depression is very high. So all of those areas, we knew if we were going to have a solution that made it easier to stay healthy, that we had to address all of those and throw in hyperlipidemia, throw in things like respiratory, like asthma, COPD. So those are all the areas that we're looking at, and I think you'll hear news from us sooner rather than later about that.
Any news you want to share right now?
Not right now, but
fun.
very soon. And that's part of why we've been adding people. You've seen we've made some changes.
Oh my gosh, you're amassing an army here of talent. So tell us who's new.
Well, so first of all, I got kicked upstairs by myself, which is hard to do.
Did you kick yourself out?
Yeah.
You're like, and that's it, I'm out. I'm going to promote myself.
So sadly, I'm not out. Not sadly. I'm really excited about it. But I became executive chairman to clear the way for Zane Burke.
Yeah.
Zane was an unbelievable president at Cerner. And, you know, Cerner is 5.5 or 5.2 billion in revenue. He managed that in a public company quarter after quarter. The people at Cerner loved him. Customers loved him. He's very customer focused. And I had known him as a competitor, as a partner, because they're a reseller of Livongo, and now as a teammate. So we brought Zane on.
And to interject right there, that was one of those hires where everybody was like, whoa, did you see? That was one of those hires this year that I think everybody was a little bit surprised about, particularly because of, I think, your past history with Cerner.
Well, you go for the best talent.
Team of rivals, man.
Yeah.
If it worked for Lincoln.
That's right. And but it was funny because we were at a conference today, and in the Q&A, somebody said, with all the opportunities, why'd you choose Livongo? And he said the opportunity to make a difference at scale, to really move the ball. And that was exciting. Second, we promoted from within. That's really important to us. So Dr. Jennifer Schneider, who was our chief medical officer, moved her to president, which most of the people in the company said, well, duh, she's been doing that for, for however long. So she moved into the president role. And she and Zane are a perfect team together. I've already seen them working together.
Have they turned on you yet?
And no, they haven't turned on me. But
I'll wait for that.
They're making the decisions now. So,
good.
And then last but not least, Lee Shapiro, who you know, I've been business partners with Lee across multiple businesses for years. He was running 7Wire Ventures, our fund, and I asked him, because this is a very large holding for 7Wire, I asked him, hey, this is so important for 7Wire, come over and be CFO, and we'll cover a lot of the 7Wire. It's all so connected. so tight.
Now, with Lee's hiring, some of our industry wonk friends are like, this is it. This is the bellwether. This is the signal that Glenn is going to take this company public, because when Lee shows up, that's it. So,
Is that what they're saying?
That's what they're
That's
saying.
what they're saying.
Just so you know, there's
So-
no question there. I'm just letting you know.
Here's what I would say. The great news about where we are
Yeah.
is that we have plenty of cash in the bank, more than $100 million, one of the best funded companies in the healthcare space, the consumer digital health space. And you don't ever want to be in a situation where you have to go public.
No, and
So-
you've said that to me before, and I
Yeah.
love that.
So we want the optionality if it seems like the best thing to go public. And we talked about creating a category. One of the reasons that you need, if you're going to be a public company, it's also a branding event.
Yeah.
And so the opportunity is something that we're definitely going to take a look at. But I can't
love
make a
teasing
commitment.
you. I love teasing you about that. I will ask you even after you go public when that happens.
Well, then I will confirm it. For
Be
sure.
like, so I bought my Livongo stock, and you'll be like, no, it's always an option. Like,
That's
no.
right. That's right.
I like to tease you about that. No, it's funny.
Okay.
Okay, so I want to go back to the applied health signals category. And
Yeah.
I want to talk about what's coming next. I mean, you
Okay.
had mentioned some of the adjacent conditions that you guys are going to go after, and even with this applied health signals approach and creating out that category, I feel like one of the other trends we're seeing this year. You and I have talked extensively about consumerism in your book, but it seems like wellness, like general wellness or holistic health, however you want to talk about it, is having kind of like, I would say like a little bit of a crisis moment right now. It seems like some of the bigger companies, and I don't know if this is because of like the political environment or reimbursement schemes, the money is not there. They're not looking at investing in wellness. What do you guys say to that? It's like, it seems like there's a struggle there. But then on the other hand, you see companies like Weight Watchers rebrand themselves into WW, and they're a wellness company now.
Yeah.
So what do you think is going on there, Glenn, in that like wellness space?
Well, so the first thing I'd say is I think wellness is great, but unfortunately, it is very tough to get people, in particular Americans, other than a small segment, a lot of who live, in this area, to focus on wellness. So I think it's tough to do. At Livongo, we're focusing on people who have chronic conditions. They have to take care of themselves. We have to make it easier for them to do that. That's not a question. Wellness is optional. Unfortunately, you can let your body go and you can not take care of yourself for a period of time and no one really sees it. So it's just a tougher thing to do. I love that people are focused on it, but it's not our focus. It's not where we're going to be. And I do think as the economy tightens, I worry that that's the first thing to go.
It seems
Particularly
like that's
for
going, right?
employers, when they're funding it, they kind of say, well, what can we cut? We have to take care of our people with hypertension and who are struggling with behavioral issues like depression and diabetes, but the wellness stuff, that's a nice to have. So we're very cautious. We're optimistic that other companies will be successful, but that's not where we're going.
I know that's not where you're going, but it's kind of adjacent to you, because a lot of times people will say a lot of these chronic conditions may be a byproduct of people not taking care of their general wellness.
That's true.
An obesity epidemic that then leads to hypertension or diabetes, or you know what I mean?
And we're in pre-diabetes.
Yeah.
So in pre-diabetes, the DPP program, we are trying to prevent people from getting diabetes in the first place. And then, that's about as far as we're gonna venture in that direction.
Got it. All right, last thoughts for you.
Okay.
What are you looking forward to, I guess, this year? I always like to ask people kind of what's hot, what's not, especially in this health tech space. So take yourself out of Livongo for a minute.
Sure.
I mean, you're a guy who's been in this industry for a long time.
Very few years.
Very young. You've done nothing. It's your first startup, yeah, right? No, but I mean, you've watched this happen, for a while, and it seems like this year, I don't know, we're in I don't know what happened between last year and this year, but it's like the tech companies, the traditional tech companies coming in, stuff happening with policy with the government. I mean, it seems like every payer now has some sort of consumer health company partner, like CVS, Aetna, or you've got other relationships where it's like they're buying PBMs. There's this kind of shuffling around of the very fundamental business model in healthcare. So from your vantage point, as somebody who's kind of been in this industry for a long time, does this feel different to you right now? And like, if so, how come?
I think it does. I can't remember who said it. A lot of people claim it, but they always said, you underestimate the impact, or you overestimate the impact in the short term, and you overestimate the impact. Did I get that right? No, you overestimate the impact in the short term, and you underestimate the impact in the long term. And I think that's where we are. We've been at it for a while, and not a lot has happened. And then all of a sudden, think about computers. For a while, they were out. They were word processors. They weren't. And all of a sudden, it changed. Everything changed. I think we're at that inflection point right now in healthcare. Why? A few things. One, nobody believes the government's going to lead anymore. So that's out. So number two, it's simply costing too much and companies can't afford it.
Right.
So when you look at the Amazon, Berkshire Hathaway, JP Morgan Chase venture, what that really is saying is they lost confidence that anybody else can solve it. They're not making it a for-profit venture, which means, why did they go in there? They said, we have to do something because we can't trust anybody else in the industry. That's discouraging, but it's exciting because they've said that. And I think more and more companies, what's fueling the growth, like Livongo this year, has already added 240 new companies.
It's crazy.
And it's crazy, but why are they doing it? Because there's no other better solution. And because of that, I think what we're going to see more and more is people saying, we might as well jump in because nothing else has worked. And in some respects, that's a perfect time for innovation. It's a perfect time for change, and I think it's going to happen.
All right, cool. Well, we'll check back in with you a little later this year and see what happened. All right? Awesome. Glenn, thank you so much. I appreciate you letting me tease you a little bit. Awesome. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.